55-year-old woman was killed by a wind-blown beach umbrella at the Virginia Beach oceanfront on June 8, 2016. Wind gusts were approximately 20 to 25 miles per hour that day. Witnesses said the wind drove the beach umbrella into the woman's chest, pulled it back out, and sent it further down the beach. That umbrella was not recovered. However, one identical to it was recovered to recreate the incident. The decedent had a puncture wound into her left breast just above the areola. The quarter-inch umbrella tip went through the skin, leaving a half-inch oval puncture wound, with surrounding abrasion of about half-inch by 1 inch due to both the entry and the angled exit of the umbrella. There was faint bruising around the wound of about 3.5 inches in diameter. There were no other external wounds. The umbrella tip penetrated the dermis, subcutaneous tissue, breast tissue, and pectoral muscle. The umbrella tip continued to a depth of about 2.5 to 3 inches through the ribs, through the pericardium, and into the heart itself. The umbrella tip broke through the 4th and 5th left anterior ribs and also fractured ribs 2, 3, and 6 in the same area. The umbrella tip entered the left ventricle at the apex, whereupon the wind pulled it back out and sent it further down the beach. Fluid and coagulated blood were found in the pericardium and the left and right pleural cavities. The left lung was compressed by hemothorax. Other abnormalities were attributed to surgical and emergency interventions. The cause of death was penetrating blunt force trauma to the chest and heart. A single wound and penetration into the heart were self-evident upon examination. The manner of death was accident. A witness actually saw the wind-blown umbrella being driven into the woman's chest and pulled back out and sent down the beach. If a witness had not seen that happen, there may have been some question as to whether or not it was an accident. The mechanism of death was puncture of the left ventricle, allowing blood to flow into the pericardium and cause a cardiac tamponade, stopping the blood flow to the head, the brain, the body, and the heart. Stoppage of blood flow to the heart muscle itself is also technically a heart attack.